your department has bought a new reusable cystoscope which can be used, flexible cystoscope which can be used in the wards, because in the ward sometimes there is a patient with difficult catheterization and it's difficult to get the patient filled into a elective flexible cystoscopy list. Sometimes a patient may have hematuria where you just need to do some diagnostics in the ward based. So the question is, it is a reusable flexible cystoscopy, and the company said this needs to be vacuum packed and sterilized. What does this sterilization involves?
So the sterilization is a process of removing all viable microorganisms, including even the viruses and the spores. And usually we have two methods of sterilization, either by the use of heat and pressure, which is the autoclave, which is the best method. However, the flexible cystoscopy is not compatible with this method because there will be damage to the flexi. We usually use this method for the rigid cystoscopy. The other method of sterilization is by use certain chemical, which is also not suitable for flexible cystoscopy. So for the flexible cystoscopy, usually we use the high level of disinfection, and this can be done by using fluid chemical solution like formaldehyde, glutaraldehyde, or peracetic acid. We keep it in for 10 to 45 minutes at a degree of 20 to 25 degrees centigrade, which this will give us a high level of disinfection, which should kill all the bacteria, all the viruses, but not necessarily all the spores.
What is meant by the vacuum packing and sterilization? What it involves?
It means that all the sterilizing instruments have been vacuumed from air, and then it's packed properly without any contamination, with a clear label about the date and time of sterilization.
Okay. What do you mean by ETO sterilization? What ETO stands for?
ETO?
Yeah, ETO.
I'm not sure. It could be
we'll come
ethyl
back.
alcohol, or I'm not sure.
Okay, we'll come back to that. What are all the stages of sterilization? Say, for example, clean and sterile and disinfected. Can you define them?
So cleaning is a process of remove all physical dirt and contamination will be removed. And then after that, we have the disinfection, which mainly include removal of most of the viable organisms, including bacteria, fungi, but not necessarily the viruses and the spore. And then sterilization, which should remove all viable microorganisms, including the viruses and the spore as well.
Okay, that's good. So
and we have a Spalding classification for the use of an instrument. So we have the critical, which means that sterile body tissue, and for sterile body tissue, we should everything used inside the body cavities, then it needs to be sterilized, like any implant, surgical instrument. So we need a sterilization for that. And then we have the semi-critical, which come into contact with the mucous membrane or non-intact skin. For this, we need a high level of disinfection, and this includes a flexible cystoscopy. And then we have the non-critical instrument, which come into contact into the patient skin, intact skin, like the blood pressure cuff or the tables or other things, and this will need a low level of disinfection.
Okay. Now, that ETO sterilization is the one which works with the vacuum pack. So ETO stands for a type of gas sterilization, ethylene trioxide. It is very useful for the instruments which are very fragile and susceptible to breakage, especially in high temperature or high pressure. After the ETO gas-based sterilization, the whole instrument will be gas packed, and it will be covered by 2 layers of plastics in the front and back, and you can see that it's like a blister pack where you need to open and then use the equipment. That is one of the easiest and the best method for using or sterilizing the flexible cystoscope is used in the ward. Okay.